If you walk into a clinic in the UK today to get cosmetic filler injected into your face, you probably assume the person holding the needle is a doctor, right?
Oh, yeah, absolutely. Everyone thinks that.
But you'd be wrong. I mean, completely wrong. And now I want you to imagine taking that exact same assumption and applying it to, well, one of the most sensitive, intimate areas of your body.
Right, which is, it's terrifying when you really look at it.
Exactly, because legally speaking, the person injecting dermal filler into your labia isn't required to have a medical license at all in the UK.
Zero medical background required.
Yeah, and depending on how they structure their, menu of prices, you could walk out of that clinic paying what seems like a reasonable £375, or you could be handed a bill for £1,500. So today we are doing a deep dive, breaking down the incredibly unregulated, high-stakes math of intimate medical aesthetics.
It really is an absolute diagnostic and financial minefield for the consumer. And to figure out what is actually going on here, we have pulled together this massive stack of sources for you. We're looking at UK clinic price lists, medical aesthetic guides, procedural FAQs, and some really deep industry articles to just sort of map out this whole landscape.
Yeah, and our mission today is to look right past all the glossy clinic marketing, the soothing pastel websites. We are extracting the real bottom line numbers for you. We want to help you understand what this treatment actually is, why people are actively seeking it out, and what the final receipt looks like when the hidden fees, the lack of regulation, and the biological realities are all finally tallied up. Okay, let's unpack this.
So before we can even begin to calculate the cost, we have to establish exactly what you are buying.
Right.
We're talking about a procedure frequently marketed as a labial puff, or is in clinical terms labia majora augmentation.
Which sounds very technical.
It does. But it basically involves taking hyaluronic acid, commonly known as HA, and injecting it directly into the outer vaginal lips.
Yeah, and I read through the clinic breakdowns, and the first thing I noticed is that they aren't just, taking a leftover syringe of lip filler and using it somewhere else.
Oh, no, not at all.
The sources specifically highlight a dedicated brand called Deserial. It's made by a French company called Vivacy, and they actually have two distinct formulas. There's a standard Deserial for hydration and Deserial Plus, which is this thicker version used to physically restore lost volume.
Exactly.
But what really jumped out at me is that both of these formulas contain an ingredient called mannitol. Now, I know mannitol from the grocery store. It's an antioxidant found in, celery and raspberries.
Yeah, it is.
So why on earth is a celery extract being injected into the labia?
Well, it serves a highly specific chemical purpose. So when hyaluronic acid is injected into the body, it immediately comes under attack from free radicals.
Unstable molecules, right.
Right, these unstable molecules that just want to break the gel down. Mannitol acts as a protective shield. It scavenges those free radicals, which preserves the HA, allows the hydrating effect to last significantly longer, and this is key. It dramatically reduces the immediate post-injection swelling.
Okay, wow. So the chemistry is highly specialized. But I have to challenge the core premise here for a second.
Go for it.
It is incredibly easy to look at a term like labial puff and just write this off as pure cosmetic vanity. Like someone just wanting to alter how they look in a swimsuit.
I mean, that's the stigma, yeah.
Right. I used an analogy in my head. It's like how a plump grape slowly turns into a wrinkled raisin over time due to moisture loss, right?
Sure.
So this filler is essentially trying to rehydrate the grape. But is there a genuine functional medical benefit to doing this, or are we just talking about aesthetic?
Oh, it is heavily, heavily functional. Actually, the aesthetic change is almost secondary for a lot of patients. What's fascinating here is the sheer mechanical power of hyaluronic acid. Well, it is a naturally occurring sugar molecule in your body that acts exactly like a sponge. A single molecule of HA can hold up to 1,000 times its own weight in water.
Wait, 1,000 times? That is a staggering amount of hydration to introduce to one specific area.
It is. And you have to consider the patient demographic we're talking about.
No.
When a woman goes through childbirth, enters menopause, experiences significant weight loss, or simply goes through the natural aging process, her body's estrogen levels plummet.
Right.
And this leads to a massive loss of natural collagen and elastin. The outer tissue of the labia majora literally deflates and loses its structural integrity.
So that protective outer cushion just completely disappears.
Yes. And when that cushion is gone, it exposes the highly sensitive inner tissues. We're talking about severe physical discomfort here.
Like what kind of discomfort?
Chronic dryness, daily chafing against clothing, irritation when exercising, and significant pain during intimacy.
And
So by injecting this specialized HA filler, the practitioner is restoring that lost mechanical cushion.
okay, that makes sense.
But the gel does something even more remarkable. The physical presence of this thick gel actually stretches the cells within the tissue, which are called fibroblasts.
And what does stretching a fibroblast actually do?
Well, when those cells get physically stretched by the filler, they essentially wake up. The tension tricks the body into thinking it needs to reinforce the area, so those cells start pumping out brand new, natural collagen and elastin.
Oh, wow. So you aren't just buying a temporary cushion.
No, you are triggering the tissue to actively repair itself.
Okay, so you are buying genuine functional relief, hydration, structural repair, and freedom from daily physical pain. But that level of specialized tissue repair brings up a massive hurdle for the patient, which is the bill.
Always comes down to the bill.
Always. The conversation has to shift to the financial investment required to get that relief. So what is the actual price tag in the UK?
So to set a baseline, right, if you were to get general dermal fillers in the UK, say a standard syringe for your cheeks or your lips, you're going to be looking at a range of about 200 to 600 pounds.
Yeah.
Intimate fillers, however, operate on an entirely different, highly variable pricing structure.
Yeah, we mapped out the data across the country to give you a real-world look at this, and honestly, the pricing models look like a complete scattergraph.
It's all over the place.
It really is. You have places like Elite Aesthetics down in Kent, quoting prices starting from £375 per milliliter.
Which is on the lower end.
Right. Then the Doctor Clinic in Lewis and the Women's Clinic in Glasgow are hovering right around £400 per milliliter. Face Perfect Clinic in Leeds bumps that up to $450, and then Dr. SW Clinics and Dr. Hela in London both start from $500.
But see, those are just the per milliliter quotes. Then you hit clinics using entirely different metrics.
Right, it gets so confusing.
Vi Aesthetics in London and Essex, they quote £825 for 2 milliliters and £1,500 for 4 milliliters.
And then Center for Surgery in London completely drops the volume metric, right? They simply charge £1,200 per treatment.
Yeah, and Cardiff Gynecology Clinic does something really similar, quoting from £1,250.
I mean, as a consumer, trying to decipher that menu is just infuriating. It feels exactly like trying to book a budget airline ticket.
Oh, that's a great comparison.
Right. You see a banner ad for a flight that says starting from £39 and you think, amazing, I can easily afford that. But then you click through, you have to pay 40 quid for a carry-on bag, 20 to pick a seat, 30 in airport taxes, and suddenly your 39-town flight costs 150.
Yep.
With this filler, £375 per milliliter sounds completely manageable for medical relief. But if you have experienced, significant tissue deflation from menopause, and the doctor assesses you and says you actually need 4 milliliters to achieve that structural cushion.
Your 375-pound treatment just quadrupled.
Exactly. You're now staring at a 1,500-pound bill.
That airline analogy perfectly captures the whole starting from trap. The industry mixing per ml pricing with flat per treatment fees makes side-by-side comparison shopping almost impossible without an in-person assessment.
You really can't do it from your couch.
No, that 1,200-pound flat fee at Center for Surgery might actually be a massive bargain compared to the 400-pound per ml clinic, provided you actually need 3 or 4 syringes to resolve the chafing and pain. You cannot compare apples to apples until a professional physically examines the volume loss.
And that in-person assessment brings us to the hidden costs. We need to look at why there is such a massive, unpredictable swing in these quotes, well beyond just the sheer volume of liquid in the syringe.
Yeah, the very first hidden cost that traps patients is the consultation fee.
Right, just getting in the door.
Exactly.
Right.
Many of these seemingly low entry point quotes do not include the cost of actually speaking to the doctor. Waterfront Private Hospital, for instance, charges a 200-pound consultation fee just to sit in a room with a consultant plastic surgeon and get a personalized quote.
That is a 200-pound gamble just to find out if you can even afford the procedure.
It is.
And beyond the consultation, there's the expertise premium. I was fascinated by Dr. Bonnie Clinic's model. They have a completely transparent, tiered pricing system based on who is holding the needle.
Yeah, I saw that.
If you want an associate on their medical team to do your filler, it's one price. A senior medic costs more. And if you want Dr. Bonnie herself, you pay the highest premium. You are explicitly paying for the practitioner's resume.
Which is absolutely critical when we circle back to the lack of UK regulations we touched on earlier. Currently, the UK government does not require a specific medical license to administer dermal fillers.
Which is still mind-blowing to me.
In theory, A person with zero medical background could rent a room, buy some filler, and start offering this procedure tomorrow.
Okay, here's where it gets really interesting.
Yeah.
With that Wild West lack of regulation in mind, does paying a massive premium like that 1,200-pound fee at a Harley Street clinic actually guarantee that you are safe? Or are you just funding a fancy waiting room with sparkling water and velvet chairs?
That is a vital question.
Oh,
A high price tag does not mathematically guarantee perfection. A highly qualified doctor can still encounter unpredictable biological complications. However, what our sources make definitively clear is that suspiciously cheap filler is a glaring red flag. A bargain basement price almost always means a compromise in one of two areas: the product or the practitioner.
well, let's break those down. How do they compromise on the product?
Reputable clinics use products that are CE marked. CE stands for Conformité Européenne, which means the product has passed strict European health, safety, and environmental protection standards.
Okay.
The gel is sterile, predictable, and pure. A clinic charging rock-bottom prices might be importing unverified, non-CE marked fillers from overseas markets where the quality control is basically non-existent.
So you could be injecting a completely unknown substance into a highly sensitive mucosal tissue.
Yes.
Wow. And what about the practitioner compromise? What happens if an unregulated, untrained person makes a mistake during the injection?
The absolute worst-case scenario in any filler procedure is a vascular occlusion.
What exactly is that?
This happens when the needle accidentally punctures a blood vessel, and the thick filler gel is injected directly inside the vein or artery. It acts like a cork in a pipe. It completely blocks the blood flow.
Meaning the surrounding tissue is suddenly starved of oxygen.
Exactly. And if that blood flow isn't restored immediately, the tissue begins to die. It turns black, and you experience necrosis, literal rotting of the flesh.
Oh my God. That is utterly terrifying, especially in that specific area of the body. How do you even stop a vascular occlusion once it happens?
You have to flood the area with an enzyme called hyaluronidase. It instantly dissolves the hyaluronic acid filler and unblocks the vessel. But here's the catch.
There's always a catch.
Hyaluronidase is a prescription-only medication in the UK.
Oh, wow. So if I go to an unlicensed non-medical practitioner because they were, 300 pounds cheaper, and they cause an occlusion.
They legally cannot prescribe or administer the only medicine capable of stopping your tissue from dying. They would have to send you to an emergency room, losing critical time.
That is horrible.
When you pay a premium at top-tier clinics, you are paying for the absolute assurance that a registered medical professional is treating you. You are buying their ability to immediately prescribe the antidote to a crisis.
Okay, so let's say you do your homework. You find a reputable, medically licensed doctor using CE marked Deserial, and you pay your 1,500 pounds for the safety and the functional relief. The next question any consumer has to ask is, what is the expiration date on this relief?
And this is where the financial reality of intimate aesthetics truly sets in. Hyaluronic acid is not permanent.
Right.
Because it's a naturally occurring sugar, your body's metabolism slowly recognizes it, breaks it down, and flushes it out of your system.
Yeah, I noticed the timelines and the clinic sources are completely scattered. Some say the results fade in 6 to 9 months. Others claim 1 to 2 years, or roughly 18 months specifically for the thicker Deserial Plus.
It really depends on the person.
But regardless of the exact month, the biological consensus is absolute. It will vanish. You will be back to square one dealing with the chafing and the pain unless you pay for a top-up.
Which is why multiple clinics in our research, including Center for Surgery and Cardiff Gynecology Clinic, offered an entirely different, permanent alternative.
Which is?
Labia fat transfer.
Using the patient's own body fat instead of a synthetic gel.
Precisely. A surgeon harvests fat from another part of your body, usually the inner thighs or the abdomen, runs it through a centrifuge to purify it, and then injects those living fat cells into the labia majora.
Wow!
Because it is your own biological tissue, once the fat establishes a blood supply, the volume increase is theoretically permanent.
But the upfront cost for that permanence is pretty steep. Center for Surgery charges from 2,500 pounds. Cardiff Gynecology Clinic starts from 3,250.
That's only an investment.
But let's do some back-of-the-napkin math here. It is exactly like the logic of leasing a car versus buying one outright.
I love these analogies.
Thanks. But think about it. If my filler treatment costs 1,000 pounds and my metabolism burns through it every 18 months, within 5 years, I have had to go back to the clinic 3 times. I have spent 3,000 to 4,000 pounds just to maintain the exact same structural cushion. Suddenly, taking out a 0% finance plan which clinics like Bellevue and Manchester Private Hospital offer, and paying £2,500 for a permanent fat transfer looks like a massive financial win.
From a strictly numerical 10-year spreadsheet perspective, the math heavily favors the fat transfer, even when you factor in the clinical reality that the body naturally rejects and reabsorbs about 20% of the transferred fat within the first few months.
Oh, it does.
Yeah, some of it doesn't survive the transfer. But you cannot make this decision on a calculator alone. You are comparing a lunchtime injectable to a significant surgical event.
Wait, hold on. To avoid paying a £1,000 top-up every year, you're suggesting I undergo full-blown liposuction. That feels like trading a minor financial annoyance for a massive physical trauma.
That is exactly the critical thinking patients need to apply. A filler appointment takes 20 minutes under a local numbing cream. You can generally walk out, go straight back to work, and the only real restriction is avoiding sexual intercourse for about 5 days.
Okay.
A fat transfer requires oral sedation or a light general anesthetic. You are enduring the physical trauma, bruising, and prolonged swelling of liposuction on your thighs, simultaneously paired with the swelling and recovery of the injection site.
That sounds intense.
You might need weeks of downtime. You are buying financial permanence, but you are paying for it with surgical risk, pain, and time.
So you really have to choose your heart. The recurring financial bleed of filler or the intense physical recovery of surgery.
Exactly.
And looking at that dynamic, it made me realize something deeply cyclical about the medical aesthetics industry. We've spent this entire time talking about the cost of adding volume to fix a problem, but the industry also captures the exact opposite end of the spectrum.
Removing volume.
Right. What if your discomfort isn't from a lack of tissue, but from an excess of it? I want to contextualize these filler costs by looking briefly at labiaplasty surgery.
Right, so labiaplasty, specifically labia minora reduction, is the surgical procedure for individuals dealing with elongated, asymmetrical, or excess inner tissue. If the inner lips protrude significantly past the outer lips, it causes the exact same physical symptoms we discussed earlier: severe chafing against underwear, chronic irritation during exercise, and pain during intimacy. The surgery physically trims away that excess tissue.
But if a woman goes to her GP with that kind of genuine physical pain, surely the NHS covers that reduction, right?
It is incredibly rare. The NHS quotes the internal cost of the procedure between £2,000 and £4,000, but they strictly classify it as a low clinical priority.
Seriously?
Yeah, unless the tissue is severely abnormal, causing chronic infection, or was dramatically damaged during childbirth, they simply will not fund it. It is viewed through an aesthetic lens rather than a functional one.
Which forcefully pushes almost everyone seeking relief into the private surgical sector. And if you thought the filler prices were confusing, the surgical price net is cast unbelievably wide.
Oh, the variation is wild.
Signature Clinic ranges from £1,495 to £4,495 if you stay awake and just use local anesthetic. But if you want to be fully asleep under general anesthetic, they quote £8,000. Bellevue's packages range from $2,850 up to over £8,100 for complex combination surgeries. And the private clinic sits right in the middle, quoting $5,100 for local and $6,900 for general. So what does this all mean? Why on earth would any patient agree to pay £8,000 when they could go to another highly rated clinic down the street and pay $1,500 for the exact same surgical excision?
If we connect this to the bigger picture, you have to look past the surgeon's hands and look at the invisible infrastructure you are actually purchasing in a surgical package. That £8,000 premium covers incredibly expensive elements.
Like the anesthetist.
Exactly. Hiring a consultant anesthetist for a general anesthetic procedure is a massive cost. You are paying the hourly rate of a fully equipped operating theater, the hospital facility fees, and potentially an overnight stay.
It adds up fast.
It does. But, most importantly, you are buying a comprehensive, ironclad safety net. Signature Clinic, for example, explicitly advertises an out-of-hours promise. If you wake up at 2 a.m. bleeding or in severe pain, they guarantee a medical professional will be available to manage the crisis.
Oh, I see. So a £1,500 surgery might be performed perfectly safely in a day case clinic under local anesthesia by a brilliant surgeon. But if something goes wrong during your recovery at midnight on a Sunday, you might be heading to a crowded A&E department because your bargain surgical package didn't include unlimited aftercare or free revision surgery.
Precisely. You are paying to outsource the anxiety of recovery.
So if you are navigating this landscape yourself, here is the absolute bottom line. The cost of intimate aesthetics in the UK is a vast, complicated spectrum. Labial filler can cost anywhere from around 375 pounds per milliliter up to well over 1,500 pounds for a full functional restoration.
Yeah.
Your final receipt depends entirely on the volume of hyaluronic acid your body requires, the zip code of the clinic you choose, and the medical pedigree of the person holding the syringe.
The overarching lesson from the data is that you must interrogate the fine print. When you see a starting from price, you must ask about consultation fees. You must confirm the product is CE marked. You must ask who is responsible if a vascular occlusion occurs.
Such an important question.
And you have to factor in the lifetime cost of metabolizing that filler every 12 to 18 months.
Because what seems like a highly affordable 400-pound entry point can seamlessly transform into a 4,000-pound, decade-long commitment. And it really brings us to a fascinating, somewhat provocative thought to leave you with today.
I'm ready for it.
We've spent centuries viewing medical treatment as a definitive action. You break a bone, you passed it, it heals. Even cosmetic surgery is to be one and done. You cut the tissue, you recover, it's over. But as we shift heavily towards these temporary injectable tweakments, whether it's hyaluronic labial fillers or facial Botox, are we no longer just buying a medical treatment?
This raises a really important question about the modern patient mindset.
Have our biological bodies essentially become a subscription service? Like a piece of smartphone software requiring constant, costly monthly installments just to maintain the latest functional update and keep the system from reverting back to its uncomfortable, deflated default state.
It's a bit dystopian, but accurate.
You are no longer buying a cure, You are renting relief. And if you are going to rent, you need to read the terms and conditions very, very carefully. Until next time, keep diving deep.